Janelle joins us again with more.
All right, thanks, Amy. Dr. Poli is back with us to answer more viewer questions. Here goes another one from a viewer. What are some of the common side effects of radiation therapy, and how can they be managed?
Radiation, as we know, is used to treat cancer, targeting cancer cells, but unfortunately, even normal tissues are affected. That's what leads to the side effects from treatment. The most common side effects, generally speaking, are patients complain of fatigue during treatment. You could see some skin changes, such as like a sunburn, redness of the skin, dryness, itching. Depending on the area, part of the body which is getting radiated, say for example, head and neck radiation can cause sores in the mouth or sore throat, and there can be some nausea or upset stomach, if you're getting belly radiation, and hair loss is another thing that could happen in radiated areas.
Are there any long-term side effects of radiation therapy that patients should be aware of?
Yes, there certainly are going to be some long-term side effects, though not everyone gets those side effects. Most common, again, are skin changes. There can be some darkening or pigmentation of the skin, which eventually can resolve. And again, going back to the head and neck radiation, patients complain of dry mouth because of decreased gland function. Sometimes they can have dry eyes, and the other long-term side effects could be some scarring and stiffness in the area of radiation, and also depending on radiation to the part of the body, sometimes you're treating the limb or armpit area, you could expect some swelling of the limb, what we call lymphedema.
Yeah, thanks for sharing. I know a lot of people just think about hair loss, but there's other things that you can watch for. Now, can you discuss just any new developments or clinical trials in radiation therapy?
Absolutely. We just heard a couple of great advances. One was, targeted therapy with Pluvicto, and then about proton therapies. In addition, there are other exciting developments that are happening in the field. We all heard about artificial intelligence that's being used in radiation oncology to better target cancers, and it's called AI-enhanced radiation therapy. And flash radiation therapy is another big thing that's being in clinical trials tested out right now. So this uses very high doses of radiation. A patient would get exposed to very high, ultra high doses in a fraction of a second, and that helps kill the cancer cells and spare the normal tissues. Hopefully we'll have good results come out of these clinical trials, and we should be able to use them in the community in the foreseeable future.
Yeah, I mean, cancer can be so intimidating, but hearing about all the options that are now available, it's pretty amazing.
Yes, I mean, future looks pretty bright.
All right, thanks so much, Dr. Poli.